अस्सलाम वालेकुम एवरीवन। कोरोना पेंडेमिक जिसने पूरी दुनिया को इस वक्त एक अजाब में मुब्तला किया हुआ है और हम सर रहे तो उसके बारे में बहुत सारी कुछ गलत फहमियाँ भी हैं और कुछ उसके बारे में एक किस्म का पैनिक या खौफ की कैफियत भी है। तो ये आज की प्रेजेंटेशन हमारी जो है उसके में हम बात करेंगे कि इसमें इससे बचा कैसे जा सकता है और ख़ास तौर पे चूँकि मेडिकल स्टूडेंट्स और डॉक्टर्स के लिए ये इंटेंडेड है तो ये बताया जा सके कि अब इनसे हम अ, अगर वास्ता पड़े और मरीज़ों को हमें मैनेज करना है और ख़ास तौर पे अगर हॉस्पिटलाइज होते हैं पेशेंट तो उसको कैसे करना है। This presentation has been made possible through the intellectual work of Dr. Professor Aftab Mohsen and one of my trainee and students who is now a consultant in infectious diseases at PKLI, Dr. Naveed Rashid. So I must admit that the most of the work I will be sharing will be contributed by these two fellows. So the first we will be talking about the prevention aspect and why we are so much addressing on the staying at home and not being an agent of spread of this disease to others. Now, few words about corona itself. Corona is not a new thing. These are viruses which has been living with us for ages, and they have been responsible for causing flu. They have been responsible for some epidemics which occurred few years ago, like swine flu, like bird flu, and they did had some mortality as well. A lot of elderly people do have infections because of these, and that's what we recommend these people to be vaccinated against flu. Now, what happened now is that this coronavirus got mutated, and instead of the previously the vectors being or the main affected being the birds or swine, this time it is led on to human transfer of the virus. And the other thing is that this transfer of virus is very rapid and very efficient. The second thing is that many of the patients who are an agent of transfer, they may not themselves be having any symptoms of the disease. They may be a very silent carrier, or they just must be, they may be transporting this virus to other people or to community at large by just being careless in their routine hygiene or behavior, and then this virus has ability to survive on certain surfaces. You touch those surfaces and those you carry virus with them, and then you touch another surface or you handshake with another person and you are transferring that virus to that him. That is the reason that this is now recommended, that to block the what we call as a chain reaction of transfer of virus from one person to other, and particularly through those who are not even symptomatic, we have to stay at home and do not be an agent to transfer of this. So, as I said, the first preventive aspect has been contributed by Dr. Naveed Rashid. He is a consultant in infectious diseases at PKLI at the moment in Lahore, and this is with his permission that I will be sharing this instructions. Now, what routes the virus gets sent into your body? You must understand and remember this. Route number one is that if you touch hands to someone's hands carrying this virus, so handshake. If you have a handshake with someone who is carrying that virus or on his hands, or if you touch any surface that is frequently touched by others' hands, and then you do not clean your hands, you do not follow the hands hygiene and sanitation instruction which we are given, and you touch your hands to your eyes, nose, and mouth. So you had a handshake, you had say touching a surface which was carrying that virus, and you did not wash your hand, and with those say contaminated hands, you touched your nose or you touched your eyes, and then you transfer that to your respiratory tract. and then there are chances that the virus would enter into your respiratory tract. The second route is that you have been close enough to a sick person who has been exhaling or having those viruses being shed off in his breath or cough or sneezing. So any patient who does not wear a face mask and he is having active disease, or if you are close enough and you do not wear the face mask, then you can have this disease from that very person. So then the virus can directly enter through your breathing. So these are the chances that the virus has entered into your respiratory system. How to kill the virus before entering into the respiratory system? You must understand and remember this, that there is one method for virus on living surfaces. Virus has an outer layer of made of lipids and oily material. If you suspect virus presence at your hands or maybe at your face, just using a common soap chemicals, you can just destroy the outer wall layer of the virus, which is made of lipid, and you have to rub soap onto that surface like face or hands and wash them for 20 seconds with the making sure that each and every part of your hand is properly cleaned and washed, and there are instructions available on media that how much you need to how to clean your hands. The second thing is that if you suspect that the virus is present on high touch surfaces or outside the home, like your door handles, your tabletops, your stethoscopes, your things which are usually maybe having this virus because of someone touched them, he was carrying a virus, or there is some talk of some airborne, say, it spread through just in particularly in places where there have been a lot of traffic of patients who are carrying those viruses. So in that, you just use an ordinary bleach or alcohol wipes, or it also depends upon what kind of a surface it is, and of course the nature of that surface, that it may not be dissolved in alcohol or right. So you have to select a say suitable material which can be uh, suitable for the type of surface you're talking about. How can you fight the virus by staying at home? Now, this is something which is very, very important. One single case who is possibly having this disease is likely to transmit in a day to around three persons around him. And these three persons, if they are roaming about in the community in next 24 hours, they would accept three other. By each of them, it would make it 9% in second day and 27 in third day, and you multiply, and it is estimated that a single case who is in community would be spreading it to almost 3,500 patients or 3,500 people, not patient, because they may not show the symptoms, but they would be agent of transfer. When you stay at home, then you keep in mind that you not only that you are staying home, but you are also prevented from the virus as well. So mm, how you can kill this virus outside? There are five sets of instructions which will be explained in the next slides. By understanding that, you can probably be at least not an agent in transfer of the disease to your near or dear ones or to the community at large. And of course, they will be helping the doctors, who are at the forefront of this fight against this corona. We are almost at war with, they are in what we'd say, they are like an army, like soldiers. They are on the front line and they are fighting, uh, and they are sacrificing their lives as well. So we have had at least one death of a young physician in Gilgit Baltistan, who has contacted this disease from one of his patients. And of course, those who are dealing and treating these patients are definitely are putting their life at risk, and this must be appreciated, this must be acknowledged, and this must be honored as well. So these are the five steps you have to follow. Prefer indoor stay, avoid outdoor visits. When traveling back to home, once it was absolute necessary that you have to go out, then there are precautions which you have to take, that you don't bring the virus with you. And when you enter the house, what precaution to be taken. And of course, when you are staying at home, still it is not that you are just sitting idle and probably are still say safe, or may not be unknowingly or consciously transferring it to others. Prefer indoor stay. Prioritize to stay at home unless there is an emergency, or you have a call of duty. You are a doctor. You are some into a profession which demands your presence at your workplace. Even doctors can work from their workplace, not on the workplace, but sorry, they can work from their homes, and it's not necessary that you have to carry on your routine OPD work, or those work, or non-emergent type of duties you can perform just by on phone call, or by there are so many other methods to communicate to your patients through Skype, or through telemedicine, or through phone call or a video call, and simple instructions to your patients can be given through that route as well. Make outdoor tour only if necessary. There are groups of people at high risk to get severe SARS-CoV infection. So following people, especially to avoid out-of-home visits, uh, preferably if you know people around you are either carrying it, or they are the patient visiting you, and you are not sure about that whether they have the disease, you should possibly be you may have to uh, restrict their visit to your home. Particularly, it's important for elderly more than 60 years of age to be at home. And particularly, it's important for those who are having chronic medical conditions like cardiovascular disease, or diabetics, or hypertensive, or those who have COPD, or those who have cancer, or those who are on immunocompromised medications like steroids, patients with certain rheumatological or connective disorders, transplant patients who are on immunocompromised immunosuppressant drugs. They should must not be visiting outside their home uh, unless it's an emergency. If you have to avoid outdoor visits, but of course if there are it's absolutely necessary to go out, then generally preferably use an vehicle which does not have other people. So it can be your personal transport car, or a motorbike, or something where no one is with you. uh, Generally, wearing face mask is not recommended, but it's better because there is some talk of an airborne infection route of spread as well. So unless you are yourself suffering from, or you are in close contact with someone who is possibly suffering from, the wearing face mask is advisable. At least maintain a social distance of around 1 meter from other persons when you are traveling, or when you are in a place where there are more than one or two people around you. It's better to go for your groceries or shoppings on weekdays, because generally the weekends are more crowded places you have in on weekends. But of course, in situation like this, when you have having either a voluntary homestay, or there is impending or likely to be uh, sort of a lockdown, so then it doesn't matter whether it's a weekday or it's a weekend. In transport, as I said, preferably you have to be in a personal vehicle like car or bike. Second priority, if you are using public transport, it could preferably be a taxi or cab, or if it is third priority, let you have to travel through public transport like a bus or a train, or say wagon or a coaster. then of course again you should be using a single seat, preferably not sharing it with someone, and avoid touching the surfaces like handles or the knobs, anything. And once you have used that vehicle, immediately getting off your transport, disinfect your hands after leaving the vehicle. Either use soap or water for 20 seconds, or you can use sanitizer, which you can carry with you all the time. This would at least disinfect some of the, uh, say, virus you might have mm, carried from a surface which might have been touched by someone with this disease who boarded that vehicle or train or bus. When you come back home after you have visited outside for your job or some emergency or your groceries, so before you uh, come back, but need to do that, you can use alcohol wipes or disinfect frequently touch personal articles like your car keys, like your car knob or handle, keyboards of the laptops, mobile and its casings, your purse, your wallet, which was touched when you were paying your say bills at the grocery shop, or your glasses which you are wearing, and of course car steerings or bike handles. They can be wiped with simple alcohol swabs, and they may also be cleaned with say your sanitizers. They can also disinfect your hands with soap and water and hand sanitizers. While you are traveling, of course, no need to wear face masks. You maintain a social distancing of at least 1 meter. Avoid any physical contact like handshake with your fellow travelers. Do not touch your face, nose, or mouth during traveling until you are disinfected your hands, and prefer to use low risk transport model like, as I mentioned, preferably uh, personal vehicles, motorbike, or uh, cab. When you enter your house, these instructions are applicable to everyone, including your family members, your guests. Preferably avoid guests in these days because uh, we are maintaining a social. But if there's an absolute necessity that there is someone has to visit you for some emergency, and similarly, don't forget that the same instructions apply to your servants and maids and everyone who is sharing the space with you. Until unless hands are not washed, do not make any physical contact like handshake, hugging, kissing kids. Particularly, don't kiss your kids, and immediately wash hands, and preferably with soap and water once you have entered. If you feel sick with the symptom like flu, isolate yourself to a separate room. If a separate room is not available, then maintain social distancing of at least 1 meter from home members. Especially avoid getting close to family members at high risk or to get these SARS-CoV-2 infection. Call doctor or call a helpline. 1166 is in Pakistan to discuss further course of action. There are plenty of organizations like University of Health Sciences in collaboration with Pakistan Institute of Internal Medicine and telemedicine. They say from UK, they are doing a very good job of offering instructions and say guidance to the people who probably have possibly are having symptoms, or in fact who need a guidance about how to isolate and how to maintain this hygiene conditions for from those who probably are having this illness, or they have been in touch with someone who is likely to have this illness. Uh, Even at home, you have to perform at least twice a day cleaning of and disinfection of high touch surfaces. For this, you can use just detergent soaked in cloth or duster. A lot of people do it routinely, and it has to be that as is that probably washed more frequently. The high stand surfaces are like your main entrance door. It is touched by everyone coming home. Room door knobs, handles, chair and sofa, arm supports, our tabletops, drawers handles, kitchen cabinet handles, refrigerator say handle, and of course tap water handles and stairs railings. Now these are the surfaces which are touched very frequently, and if you are not maintaining a very high hand clinic practice or exercise, and of course there are people coming to your visit you, or like your servants, they probably may not be uh, maintaining that high standard of hand hygiene and hand washing. So it's better that at least twice a day you make these surfaces clean with disinfectant or detergent. If you yourself feel sick with flu symptoms, isolate yourself to a separate room, right? And of course, maintain a distance, and do not get close to your family members. Call doctor helpline as already mentioned. Stay clean and stay safe at home. Keep elderly and frail family members away from outdoor exposures. Maintain a social distance to remain distant from the virus. Do not use mask at home, or not very necessary if you are not having any symptoms, or if you are not visiting a place where there are likely patients who had this disease. But since a lot of patients may be asymptomatic, so in that case it's important that it's better that if you wear a mask, and that probably would be an extra guard, and an ordinary surgical mask is enough. N95 mask is reserved for those who are in direct contact with these patients and who are treating, and this there's already a shortage of N95 in the market. So do not insist on that it's just N95 mark which will bring. So become a helping hand of your doctor from your home. If you don't go out, you would not be an agent of spread. You would be lowering the workload on the hospitals and doctors and ICU, and you will be preventing. So as I said, one single person who can transfer it to three other persons. If you break that chain, that by staying at home, you are not an agent of transfer. You are definitely helping everyone fight this disease. So this is what about the preventive aspect of this disease is. Then this is a guideline of treatment for those patients who are symptomatic and who have the symptoms of pneumonia. Majority of these patients who say get this infection may have milder symptoms in the form of just a slight flu or body aches and fever and some cough. And this is what we usually experience in many kind of flus or other say members of this coronavirus family, which we have been experiencing, and we are not bothered about it. What bothers is that this leads on to a very uh, rapidly developing fulminant type of pneumonia of the lungs, which in which the lungs become say rapidly develop shadows on the x-rays, and there is difficulty in gas exchange, and patient becomes dyspneic, and this is a very high mortality if this pneumonia develops, and particularly this mortality is in high in elderly people, the patient who are 70 or 80 years of age, and it is more in patients who have say other comorbidities. So, of course, there is high mortality, but this high mortality is in, say, elderly people, and majority of the deaths, which particularly in the Italy has occurred, they have been in patients above the age of 80 or so. And another reason for that was that in the first go, a lot of healthcare workers and doctors, they themselves got infected, and there were not enough doctors left in the hospitals to take care of these patients, and they have to call in final year students to, or the those who have just graduated, and less sense to practice, because but still that. So as I said, if we follow the instructions, that we do not say overload or overburden hospitals by staying at home and not say bothering them for the healthcare workers and doctors for minor complaints. You can possibly be an agent of say prevention, and you can be agent of help, because if our doctors get overloaded, they start getting infected, they start getting we have already had one doctor lost in taking care of this patient, young person, Dr. Osama from Gilgit Baltistan. So we can't afford that. We can't afford that. Kindly cooperate with this. Now, these are the symptoms of coronavirus disease, that usually you have a symptom like fever, cough. You may feel some difficulty in breathing, not always. You may have fatigue, body aches, and headache. Sometimes diarrhea, sore throat, and some itchiness or redness or pink eyes are also associated with this disease. As it happens in many other viral illnesses, a common cold and other flu do have these symptoms. Once you have suspected, and you have the first thing to do is send their nasal as well as pharyngeal swabs for confirmation. And this confirmation of the virus usually takes around 24 to 48 hours, and for that very period, the subject must be isolated. Must be isolated. It should be kept in a place where he is not being in contact with any family member or an attendant. Then, if you need to hospitalize him, and we'll talk about indication for hospitalization, then you definitely have to do these labs. There should be to do daily labs like complete blood count with differential, and of course it's more important that, as like other viral illnesses, this also leads to lymphocytopenia. There has been talk about a ratio of neutrophils to lymphocyte being one of the indicator of severity, or one of the indicator of predictor of severity. We'll talk about in a moment. Complete metabolic panel, and of course you will do the CPK or creatine phosphokinase as well. It's important to do viral serologies, particularly the HBV serology, like surface antibodies, hepatitis C antibodies, and surface antigen as well. Hepatitis C antibodies maybe like for B, you probably need to, as I said, the surface antibodies, core antibodies, and surface antigen. And for C, you do antibodies only if you think that the person was positive in past and has a protective levels or not. HIV 1-2 antibodies and antigen may also be done, because as we already mentioned, that those who are immunocompromised are at risk of complications and severity. For risk stratification, that which patients are at risk of having a severe disease, you do D-dimers, you do ferritin, you do C-reactive proteins and ESR, you do an LDH and troponin, and of course baseline ECG, because myocarditis is one of the feature of severe disease. Or if clinically indicated, जो and if we suspect that the patient may have a secondary bacterial infection as well, so it is better to send routine blood culture, at least 2 sets. These patients are likely to go into sepsis and shock, and this shock may terminate in pre-renal failure or acute kidney injury. So it's serum creatinine at the baseline, and urinalysis for spot protein urine or urinary creatinine ratio, albumin creatinine ratio must be done. Procalcitonin is a marker of lung involvement and a marker of pneumonia. Higher is the procalcitonin, higher is the possibility of having a severe pneumonia. And same goes with the interleukin 6, which is again one of the inflammatory markers, and higher the level, the higher are the chances that the patient would be having a severe disease. X-ray remains the cornerstone of management, and possibly since these patients are likely to be sick and may be dyspneic and may not be able to transfer to the routine X-ray radiology department, so portable X-ray would be better option. Uh, of course, what you see uh, on this X-ray, you probably need both PA film and lateral ambulatory and ambulatory patients. Consider only if low suspicion of COVID and result would change management to affect person under investigation status. That means that if patient is having a milder symptom, there's not dyspneic and not at all, you may just be treating him as an outpatient and not admitting him. But if patient is symptomatic with dyspnea, of course, then X-ray has to be done. Routine sputum for gram stain should be sent, sputum culture should be sent, but of course, taking all the necessary precautions of self-care. The person who are handling these patients, they must be in a full gear, which is total personal protective equipments with the face mask, not only face mask, but in fact, the whole, say, covered face along with these suits which they cover them from head to toe, and they once in they are off duty, they should be changed with taking all the precautions that the outer surfaces of these suits are not touched, or if you touch them, you immediately wash your hands thoroughly with say detergent or with the soap, and maybe hand cleanser. Legionella, Staph pneumonia, urinary antigen would be helpful, because this picture is like of a pneumonia, and you are not sure that, if you are not sure that this pneumonia is likely to be viral or a bacterial or a typical pneumonia, so then you must be doing this antigen as well. Uh, Sputum for AFB is not at least recommended in people in the West, but I'm not sure that how many of active tuberculosis patients will be having in these situations, and how. So it's not say unwise to get a sputum check for AFB as well in our population with high prevalence of tuberculosis. Treatment is we don't know that what is working and what is not working. Since it's a viral disease, and we have been treating other corona infections like bird flu or like swine flu with the oseltamivir 75 milligram BID. So it's available over here. So we can possibly be continuing with that routine till we have a definite recommendation of a specific antiviral, which is there are quite a few which are being tested and are under trial in various developed countries like USA or in, say Italy or China, but we are not very sure. Ceftriaxone adding to this, or cefpim, if there is a risk of multiple drug resistant organisms, or patient is definitely immunocompromised, so you do add this. Azithromycin 500 milligram per day, once a day, or 25 milligrams. Initial loading dose of 500 milligram, and then 250 milligram daily for 4 days is recommended for treatment. It helps this say virus, stops the virus entry into the cells. Avoid nebulization, because this may lead on to some injury. Use meter dose inhaler instead, but once those patients are mm, too sick and they are being put on nebulization ventilators, then of course you have to do some sort of a uh, nebulization via the ventilators to treat or bronchospasm if it occurs. Uh, Role of ACE inhibitors in the disease this COVID-19 COVID-19 is emerging, because this SARS-CoV-2 uses ACE2 receptor for cellular entry, and these medications, this receptor blockers, by blocking the receptors, upregulate the receptors, and of course this would help in entering the this into the polymorphs, and which will then take care of this infection. So it is advisable. It is not recommended that you should start using ACE inhibitors in patients who are not on them. But those who are using it for other reasons, they should be continued. There is no definite role of steroids. Only consider if there is like refractory septic shock. Then, of course, steroids would be indicated. And similarly, those patients who are already having using inhaled steroids in the patient with COPD or asthma, you may reduce this. They may reduce the local immunity, and they may promote viral replication. So they should be avoided unless there is an acute indication. As I said, do not recommend starting ACE inhibitors, RB or ribavirin for COVID-19. Another important thing is avoid non-steroidal anti-inflammatory drugs while patients are admitted. For fever, you have to use Panadol, paracetamol only, and don't use, particularly ibuprofen is not to be used, and other NSAIDs should be avoided. The epidemiology of the disease is that disease is likely to affect people more than 55 years of age. Similarly, in category 1, the patients who have the symptoms, as already mentioned, of fever and headache and cough and sneezing and nasal, and they have a respiratory rate of more than 25 breaths per minute, or those who have pre-existing pulmonary disease, or their heart rate is more than 125 beats per minute, or they are a patient of chronic kidney disease with impaired renal function, and sometimes they may be on dialysis or immunosuppressants. So these are the patients who are high risk. Similarly, diabetics, hypertensives, patients with history of cardiovascular disease, or patients who are on biologics like for rheumatoid arthritis or for other diseases, they are at risk. Someone who has had a transplant or immunosuppression, they are at risk. And all patients with HIV, regardless of their CD4 count, are high risk patients. Similarly, there is a category 2 of high risk that, as mentioned, respiratory of more than 24 breaths per minute, heart rate of more than 25 beats per minute, or digital oxygen saturation of less than 90% on room air. This makes a category 2 of high risk patients. Similarly, there are lab tests when you are admitted the patient, and if there is the D dimer is more than 1000, CPK is twice upper limit of normal, or CRP is more than 100, or a patient is diabetic with A1C of more than 7.6%, an LDH of more than 245 units per liter, elevated troponin level on admission, and an admission if the absolute lymphocyte count is less than 800, or ferritin level is more than 300, they are a high risk patient, and of course they demand an admission in intensive care setup. Statins, if there is no contraindication, can be continued like both at Orva, right? But if their CPK is high, and if their ALT is more than 3 times of upper limit normal, stop statin in the treatment of these patients, or if they are already taken, they should be stopped. For a patient with mild disease with the oxygen saturation more than 90%, there are no risk factors. Only supportive care is needed, and that supportive care is in the form of antipyretics and maybe cough suppressants. And of course, the most important thing is isolating these patients, right? They can be managed at home. Those with no risk or low risk can be managed at home, and because taking them to hospital would mean that they are an agent of spread, and they are overburdening our healthcare system. If the oxygen saturation at home at room air is more than 90%, and there are risk factors, severe disease, supportive care with the close monitoring and continued application of clinical trial of remdesivir is indicated. But of course, there is this is not being done in our local settings. Moderate or severe disease like patient in ICU or that, of course, remdesivir, if possible, can be obtained through international agencies for trials, and then their current dosing recommended for this drug is 200 milligram IV loading dose and 100 milligram IV daily for 10 days. In moderate to severe disease and category 1 and category 2 or 3 feature with progressive disease, hydroxychloroquine has been shown to have some benefit, or at least limit the extent of the lung involvement, and recommended dosage 200 milligram twice a day for 2 days, and then 200 milligram daily for next 5 days. There are drugs which are under trial. Lopinavir and ritonavir are being tested and tried, and we may come up with data soon that whether they should be prescribed. Of course, their availability over here remain a question, and they would not be available pretty soon. Refractory and progressive patients who are in ICU, there is talk about giving interferon beta 1 as well, but this would need to be combined with another antiviral, like you cannot give it alone. So it can be combined with hydroxychloroquine as well. This COVID-19 is a disease where there's a what we call a cytokine storm. So there's lot of this pathophysiology of this disease is because of a very high release of cytokines into circulation. These cytokines, instead of doing good, they do harm, and they harm the various the organs, particularly the lungs. And this is so there is a talk about using this tocilizumab, which is monoclonal antibodies, to combat this release of this cytokines. Again, this is being tested and tried, and need to, of course, it would be beneficial in patients who are have a interleukin 6 levels done, and which are elevated. This is available over here, and it is being used for patients with rheumatoid arthritis. Expensive, but of course, in dying situations, you probably would be trying everything which can be of benefit. Role of intravenous immunoglobulin is questionable, and again, of course, that would add to the cost of treatment. But if you consider in patients who are in intensive cares, 1 gram per kilogram daily for 2 dosage may be considered. Those who have already transplant, they decrease their cyclosporin and tacrolimus dose by 50%. CellCept or mycophenolate should be stopped, and similarly azathioprine should also be stopped in these patients. Then, of course, kidney patients' proximate target tacrolimus level is around 5 nanogram, and cyclosporin level is 25 to 20 minutes. If they're maintaining that level, they can be safe for few days of stoppage of that medication. If you are a healthcare professional and you come across these patients, and you think that post-exposure prophylaxis, so there is at least no role of post-exposure prophylaxis. All you have to do is you have to self-quarantine yourself for 14 days and monitor for symptoms. There is a study going on with hydroxychloroquine and azithromycin, but results are still awaited, and it cannot be universally recommended to use this. Thank you very much for watching this. I hope that it would be helpful. We'll be uh, looking for your feedback. Do subscribe to our channel and like it, so that this can the message can be disseminated to everyone. Thank you very much.